Today, I would like to talk about the leadership gap that no one talks about in academic medicine. Now, we have learned how to do a lot of things well in medicine. We are good at seeing patients, being colleagues, taking call, being responsible. But as you finish your fellowship and you move into early attendinghood, you think the path looks clear until you start it. But there are a lot of things that are clear. You need to pass your boards, you need to get your competencies, you need to finish your milestones, you need to do continuing medical education. There's a lot of things that are laid out in front of us. But as you work your way along, you get a lot of feedback, trust me. But that constant feedback can just start to wear on you. As you hear more and more, you think you know what success looks like. But the problem is that nobody prepares you for that transition from trainee to faculty. I mean, everything changes in a blink. And I'll tell you, I had a lovely conversation with somebody I worked with who was a fellow at the time, actually. All she could think about was that she'd spent her entire career learning how to take care of somebody else's needs, of responding to the way they liked things done, the way they wanted it draped, they wanted the clinic note done, the way they wanted patients presented to them, but they did not know how to look for that for themselves. And the idea of not being the trainee anymore, but in fact of being somebody who makes the decisions was really hard for them to think about because they had spent decades really making sure that they knew what people wanted, whether it was their professors or their medical school folks or on clinicals. And so it's hard. And that structure disappears overnight as you start as an early career attending. All of a sudden, they give you a schedule or they tell you, like, here's what you have to do. But even harder sometimes is if they say, what do you want? Because you don't know what you want. You actually haven't had an opportunity to figure that out. What instruments do you want for your clinic room or for your operating room? What do you want the clinic breaks to look like? What do you want your clinic schedule to look like? How many in an hour? How many new? How many return? How many urgent? And so there's a lot of things that feel overwhelming at the beginning, and your success metrics get kind of vague. You start trying to figure out through guesswork or through what works for a mentor, but it isn't necessarily what aligns with your values. It just might be what aligns with somebody else's. It's like getting somebody else's preference card if you're a surgeon. It always seems like they're like, I'm sure you're going to do things the exact same way, but you don't, even if it's just the glove size is wrong. And really, what you want is for someone to sit you down and tell you, this is what the career arc should look like. This is what you should accomplish in your first 6 or 12 months. And then once you've got it kind of more figured out and you're more comfortable, and I tell everybody it takes 2 years to be pretty comfortable in that first job, then you have to figure out where you're going. And if you're really lucky, you've talked to somebody who's helped you set up systems. So that stuff works from the beginning, whether it's seeing the kinds of patients that you want to study or whether it's figuring out the right breakdown between academic time, research time, teaching time, clinic time. And then what you want to do is to really make sure that your values align with your time so that it doesn't feel like there's this dissonance or this disconnect, but that it feels like you're moving forward in the way that you always dreamed of. And so the other thing that's really important is to understand what the promotion committee cares about, because most of us join academic medicine with the intention that we're going to move ahead. We don't want to stay an instructor or an assistant professor. We want to move up. And if we don't understand the criteria for that, we may be doing a lot of things and saying a lot of yeses and spinning our wheels in ways that actually don't get us promoted and don't tell the story that we want to be able to tell so that we can move ahead. And the problem is, even if you start thinking about this as leadership roles or how, if the fact that you need to sequence them, like, what do I need to do first? Do I need to be working in a clinic and leading a center and becoming a division director, maybe being a medical director, move my way onto whatever you want to do next, a dean job, an assistant dean, associate dean, work your way up to full dean? Or do you want to work your way up as the program director after being the assistant program director, after being the medical student director? What do those look like? Do you want to do organizational medicine? So you volunteer for a committee and you head a committee and you get on the board and then you work your way up to board president or executive committee or president of the organization. But all of those have some fairly reasonable progressions, which you may have no idea how to get to if you don't have some important conversations. Now, for decades, we really ran academic medicine as apprenticeships. And you watched what the senior faculty did, or you watched what your chair did, and you emulated that. But it's not really so straightforward anymore. And quite honestly, a promotion isn't as straightforward because there's a lot of different tracks that didn't necessarily exist when I was starting. And may not have even existed when you were starting. So if you're not keeping track, your medical school may have changed what kind of opportunities you have. And oftentimes it used to be that research or education were the two primary things, but there may be mentorship or entrepreneurship tracks. There may be some that are straight clinical. There may be some that are straight research, depending on what your interests are. And so really understanding the tracks at your institution is really important, and the definitions and requirements. I was working with somebody the other day who realized he needed to take CME in a certain area. I was working with somebody else who realized that the narrative they needed to tell didn't necessarily require them to have an international or a national leadership role, but they definitely needed something that was regional and or institutional. And so if you're still using that same informal watch and learn approach that was very popular when I started, the result isn't really going to be a success. It isn't necessarily failure either, but it's drift. There are talented folks out there, probably you, working very hard, but not with the clear direction that's going to show a promotion committee what you're supposed to do next. And so that's why people end up in burnout. It's about that ambiguity. I'm doing all this work, it's not getting me where I want to go, and it's not clear how to get there. So, what you need is something that helps you. And if you think, oh, the solution is better self care, more resilience, and you have better boundaries, those are great things. I'm going to tell you, if you could do all of those, that's absolutely going to be great, but it may not get you promoted. What you have to do is understand what comes next so that you have some alignment and some certainty. Now, uncertainty may show up as not knowing what your current work actually matters as. Is this clinical work going to get me somewhere? Is this committee I said yes to going to make a difference? Is my interviewing the residents showing that I have great citizenship? And it's harmful not knowing if a leadership role you've taken is going to help or actually harm your career. Maybe you said yes to the wrong path. So if you really are on a research track, being in charge of the educational curriculum may not do as much as you had hoped it would, and definitely won't be as useful for you as somebody who's on an education track. And similarly, if you're on a research track, being somebody who works with PhDs or is working in a collaborative grant setting or even just starts working on clinical trials, all can be incredibly useful, but may not be as useful for the person trying to get ahead in an education track. So underneath that uncertainty, I want you to be really understanding that can become this very negative emotion. You can feel like this growing disconnect between what you value or what you wanted to do with your career and what you're actually doing on the day to day. If you went into medicine because you value a certain aspect, you want to make a difference in that field and you want to make sure that you have the opportunity to spend your time on that field. So if I really care about making sure I make an education goal and I'm spending a lot of time doing things around clinical efficiency in the clinic, that's not going to make a lot of sense for me. And it's going to feel like a disconnect because I'm taking the time from the thing I want to do something that's valuable for the department, but may not fit my narrative. And so that's where I think it'd be really useful. And it's not just the work's hard, but it's disconnected from the version of the physician that you want to become or that you're on track for. And that's why all these conversations about burnout and resilience can sometimes miss the mark. You can't meditate your way out of a structural ambiguity. And you certainly can't self care your way out of values misalignment that you didn't consciously choose. And so, what you have to take note of at the beginning is you have to have some strategic frameworks. Don't just accept a leadership role because someone asked you, even if that someone's your chair, because it may not be on your trajectory. And worse, it may actually feel so disconnected from your job that you don't want to work there anymore, that you don't have the same goals because you don't feel like they're attainable. And it can be confusing, if not completely unstrategic. And many of us will take a role at the beginning of our career that maybe made sense, but does not make sense anymore. It may have been a service role or something else. There's people who are running the CME course, but not looking for an educational follow up. There may be people who are finishing some big research projects in basic science, but that may not be what they're looking for at this point as they're working on more of a leadership track. And so being conscious and looking at what you're doing every single year and making sure you understand the story you want and the values that it helps you achieve are really important. So, the intervention that actually changes all this is not a wellness program, but it's clarity. Thinking about how leadership is evaluated in practice, but not on paper. So, understanding which roles signal your readiness for the next step or which ones are going to stall your career. And then making sure you understand them. I can tell you there was a point in my career I looked very seriously at whether I wanted to be a program director. And I love working with trainees. I love working with residents. I had enjoyed being the medical student director, but I was really on a research track at that point and then looking towards leadership. And so this would have taken me down to more of an educational road, which quite honestly didn't fit my story. And so I realized there were other people, this was their story. It made a ton of sense. I still interviewed for residents. I still mentored a ton of medical students and trainees, and I just worked with them in different ways. They made more sense for my story and for theirs. Now, the beautiful thing is when you get this kind of clarity, the transformation can happen very quickly. You can stop overcommitting to the wrong things. You can choose roles that genuinely advance your goals. And you can help understand how your decisions of today connect to the future that you're looking for. Most importantly, it will oftentimes help you regain a sense of agency over your own career so that you're doing the things you want to do so that the career path going forward is understandable and much less frustrating. Now, I also want to make it really, really clear that if you're in this situation right now, this is not a personal failing. This is just that we don't teach explicit systems for leadership development and definitely not for career strategy. We've relied on this tradition of having great mentors or sponsors or watching the people in front of us and hoping that their path was the one that we wanted to follow. And so this approach works beautifully for the subset of people who either really know what they want at the beginning or are following the right person. But it's disadvantageous for most other folks. So if you're a few years into your career or 5 or 10 years in and you feel like you're working incredibly hard, but not getting anywhere, that is not a character flaw. It's just a predictable outcome of a system that never taught you how to navigate it. And this is where strategic mentorship can make a huge difference. And quite honestly, the frameworks that we have in our coaching programs, because it's not mentorship that is purely reactive, but it is actually strategic guidance that helps you end up where you want to go. Now, if you work with a coach or a fantastic mentor, they can help you decode that promotion process and help you look at how leadership works at your institution and then understand which roles make sense and which ones don't. When are the strategic no's going to happen and when are the enthusiastic yeses the right thing to do? And help you understand which roles you may have outgrown or just may not get you where you want to go. So I just want to emphasize it is not about working harder. It is not about becoming more resilient. It is not about meditating, as great as those things can be. It's about clarity. I want you to understand your values. I want you to understand the career you want and where you want to go. And if you need help with that, there are people who can help you. Now, if this sounds familiar, start by getting honest with yourself about what you don't know. What decisions are you making by default rather than design? Which roles are you in because you said yes, but maybe don't fit you anymore or never fit you? And do you understand if you want to move into leadership, how that gets elevated and which positions will move you forward and which ones won't? Now, if you can turn all that into a 3 year plan that's aligned with your goals and your track, perfect. But if your answers are these just kind of vague, you are not alone. You are exactly where the system left you. So making implicit changes changes everything. If you're working with a coach or you're working with your mentors or you talk to your chair or your division director, those are beautiful places to start. And it helps you find some frameworks in academic medicine that may not have been shown to you. The gap is real, but it's also solvable. And strategic clarity isn't something you should have earned after a decade. It's something you can do at any time, but with intention. So if you're struggling with your career direction or leadership decisions, please reach out, whether that's to your division director or a peer or to a coach. And if you have interest in doing this at the whole department level, please reach out to us because we are actively looking to partner with departments for our faculty excellence and retention initiative called FAIRY. Now, thank you so much for joining me. And if you liked this, please share with a friend. Please also subscribe, rate, and review, and tell everybody how much you enjoyed it so that other people will get a chance to hear this and the algorithm will like us more. In the meantime, I look forward to talking to you next week.